Dr. Oxley, is it accurate to say that while the symptoms of Covid-19 are flu-like, when it advances, it's a disease that's actually affecting the body's blood system, not the respiratory system?
Yeah, I think that's a fair representation. We're still learning about how the virus causes disease inside the body and in particular other organs. Our experience has been in the brain side, so we're seeing patients that are having brain complications from the disease. And of those, most concerningly, we're seeing an increase in the number of strokes that are happening in our patients presenting to Mount Sinai Hospital. But it's not just all strokes, it's strokes in young people in the large blood vessels that we're seeing a significant increase in, sevenfold increase in the last couple of weeks, actually.
How did you notice this was happening?
I was doing a procedure on a 44-year-old male who had no past history, who'd been at home for a week with a fever and feeling unwell. And that's unusual. We only see that every few weeks, and we've seen 5 in the last 2 weeks. And then we started to see a run of these. So that led us to put this case series together and submit that to New England Journal of Medicine.
Is it people that have been in ventilators in ICU, or is it something different?
No, we are talking about people at home with COVID who may have mild symptoms of COVID, but who are then developing sudden onset of large vessel stroke and then requiring to come into hospital as an emergency.
Is the stroke situation present in older patients as well?
It is present in older patients, but we're seeing, in the last few weeks anyway, a particular increase in the spike of young patients.
If you have coronavirus and you are one of the people who is likely to be affected by stroke, are there signs that this is coming, and is there anything that can be done to ward it off?
2 of the patients in our cohort did not call the ambulance for 20 and 26 hours because they were afraid of coming into hospital, and because we've been told that if you're sick at home, symptoms of fever and shortness of breath are the ones that you might call the ambulance for. But if anyone develops symptoms of stroke, and so the acronym to remember is FAST, face, facial droop, arm weakness, speech disturbance, and then time, call the ambulance immediately.
You mentioned you've seen a small number of cases. Is it too small a sample to extrapolate from in terms of saying we can expect to see stroke in X percentage of coronavirus cases?
It's certainly a small sample size, and we are learning as we go. We are hearing from our colleagues around the city that stroke numbers are up all around the city. So yes, it's still too early to know absolutely what the real numbers are going to be. But one thing that's concerning is the D-dimer is a test that's becoming a useful indicator of how severe disease is. And D-dimer is a marker of how likely your blood is to clot. So that tells you that what we're seeing is a disease that is partially working at least by increasing blood clotting in the body, and that's why we think this increased risk of stroke is occurring.
Dr. Oxley, thanks for your time. Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.